This project's focus is on mental health transitional care in the Austin community. We chose this critical issue because it affects such a large portion of our population. Mental health illness accounts for over 15% of disease and more than 90% of suicides. The demand for psychiatric hospitalizations reflect the continued burden of mental health disorders in this area. In the last decade, only 50% of adults with severe mental illnesses received care. After the 2008 recession, state mental health agency budgets were cut. This made the community care situation even more precarious and often resulted in inadequate services due to lack of funding. The consequences of a lack of access to health services can lead to unmet health needs, delays in receiving appropriate care, inability to get preventative services, and preventable hospitalizations. Mental illness is not only a burden on the afflicted individual, but it also adds social, legal, economic, and political burdens on our community and the world as a whole. There are many barriers that make navigating the healthcare system difficult. These include having little to no money to pay for doctor's visits and medications, not having reliable transportation in order to access necessary care, and the lack of an effective medium of communication with which providers can use to check in with patients. Many studies have demonstrated that improved continuity of care has a significant positive impact on reducing the number of rehospitalizations, the cost to individuals and the healthcare system, and most importantly, it also decreases the rate of mortality of mental health patients.
Rehospitalization involving mood disorders and schizophrenia is more common among the following groups of patients: those covered by Medicare or Medicaid, adult males, patients living in metropolitan areas, and patients living in the lowest income communities. It would be game-changing to create a program that could address a patient's mental illness from a multidimensional perspective, including all familial, social, biological, and pharmacological aspects. We propose the need for grant-funded transitional care clinics in areas of Boston that have high rates of mental health patients. Transitional care units are skilled nursing facilities that assist patients as they transition from a stay in the hospital to home. It will serve as a bridge gap for mental health patients that have a high risk of being readmitted into the hospital within 30 days of discharge. Our goal is to work interprofessionally with legislative leaders, public health professionals, healthcare providers, and social workers to start an action plan for a TCC in the Austin area. Our first plan of action would be to secure grant-based funding and donations to start a transitional care center and to reduce costs for the patients. We will also implement and coordinate with surrounding Austin hospitals to ensure that patients are aware of the resources available to them. Hospitals should make appropriate referrals to patients that they think are at high risk of rehospitalization.
Created using Powtoon.